may request our brother, elder brother, Dr. C.M. Dalorana, to say the live sketch and this curriculum video of Professor Afiquor Rahman.
Thank you so much. As you have heard, the Professor Idris Lasker is the father of the urology in Bangladesh. And he started only with 3 beds in Dhaka Medical College in one unit and under the general surgery. Then he fought for the independent urology unit, which started, and Professor Munir Jaman was sincere teacher, and Professor Naib Ali, they also supported him, and then the urology unit started. Today we are lucky enough, me and Jaman, both are the assistant registrar and registrar of the urology unit. I was the assistant registrar in the early 1974, and I was working with sir. Now, it's a pleasure to introduce Professor Dr. M.D. Afiquor Rahman, who is now the principal of Ad-Din Medical College and Hospital. And he is graduated from Mymensingh Medical College in 1980. He obtained FCPS in General Surgery from Bangladesh College of Physicians and Surgeons, BCPS, in 1987, and MS in Urology from University of Dhaka in 2000. He served as assistant and associate professor in Dhaka Medical College Hospital, Dhaka Medical College and Sir Salimullah Medical College. He is a member of American Urological Association, AUA, and attended many AUA conferences. He has many publications, mainly in prostate problems. For the last 5 years, he is doing a free prostate camp for 1 month, only in February each year. I don't know why it is February. I hope we will be listening from him why it is only in February. So now I would request Professor Dr. Afiquor Rahman, please present your paper. Thank you.
Professor Muhammad Afiquor Rahman, I request you to receive a gold medal from Professor S.M. Ghulam Kibriya and then to deliver speech. Congratulations, Professor Muhammad Afiquor Rahman. Now I request Professor Muhammad Afiquor Rahman to talk on his topic, Journey with Prostate over 3 decades.
Bismillah ar-Rahman ar-Rahim. I am very much honored to be here and sharing my journey with prostate for long 3 decades. I would like to dedicate this honorable period, that is this moment, for those patients who allowed me to get this opportunity. Respected chairpersons, audience, delegates from home and abroad, ladies and gentlemen, I am requesting you all to allow, accept and accompany me for next few minutes in the journey. And my academic, already it has been discussed. Now, how I started, this is the picture of 1938, about 82 years back. And All are army personnel of British Army. Most left one is my father. My father was not a doctor. In Second World War, when he was working in field ambulance, he met one doctor's couple and dreamed to educate one of his kids as doctor. To satisfy the desire of my parents and to fulfill my dream, I was admitted into my Mission Medical College. When I was a student of third year in 1977, I met this gentleman, Professor Purnendu Vikas Rai, as surgeon. One day he was demonstrating one hernia case in surgical OPD wearing an apron. In the same day, he was operating in operation theatre wearing gown, cap and mask. And he was a king over there. Same day he was taking lecture with wearing coat and tie. Same person, same day, 3 different places, 3 dresses and 3 dimensions attracted me a lot, and I decided to be a surgeon. When I was interned in 1981, my father was admitted into my Mission Medical College with acute retention of urine, and first time I saw my strong father to cry like a baby. To cut the long story short, operation of my father was not possible in my Mission Medical College. As he was army personnel, subsequently he was transferred to CMH Dhaka under Brigadier Siraj Jinnah. Unfortunately, before the day of operation, Brigadier Siraj Jinnah sir had to leave country for 6 months training. That 6 months, my father had to carry a catheter life. That was the ordeal of my life. I could not sleep, I could not take food, even I could not laugh. And that incident emotionally shattered me. And that emotion created some motion, and I decided to become a neurologist. But at that time, there was no facilities to learn urology, so I completed my FCPS in general surgery, and I started skill development, working as consultant surgeon in different hospitals. At that time, in district level hospital, there was no anesthetist. The only way is to use open ether for surgery. And I learned this technique from my medical college, and I was practicing general surgery cases in Norail, Jashur, Zinaida, and Sirajganj General Hospital for long 10 years. And these 10 years, I was learning and practicing special care with open prostatectomy. And I was searching for opportunities to learn urology. When urology started in our country in 1997, I got admitted into MS Urology course. And I am mentioning here, Professor Kipriya sir was that time giving me mental support to come over here and to start urology. I am very grateful to him. And first time I went to Monjibai Patel Urology Hospital, and in 1998 with one of my some of friends. That was my first outside country to learn urology. Then, as I was targeting to become urologist, my dissertation in FCPS was, that is, comparative study between transvesical and retropubic prostatectomy. In my MS urology, the thesis was prevalence of symptomatic prostate in elderly males. That was the first study, field level study in our country. And that is my field level study in Gazipur, that is Kawalta Union, the Union Parishad I used, that hospital I used, and using liquid paraffin in this compromised way, I had to do this DRE to perform this study. And this van and this ambulance I used, this health worker helped me, and that study documented that 39.5% of our elderly males suffer from this prostate. And it was subsequently published in our Journal of Urology. Honestly speaking, that journey was not that smooth and easy. When we were in MS Urology course, transfer technology, especially into urological technique, was not that easy. So I had to arrange own arrangement in my own clinic, doing some free operation with the help of some of my friends, and I'm grateful to those patients and those friends helping me. And this is the situation I faced in my long journey. I got some persons pulling down, some persons pushing up. I would like to share some of my experience over here. This gentleman first demonstrated me in 1998 in private clinic in Dhaka city, that is Verumentanam. And I am grateful to Professor M. Salam and to make my journey smooth by that help. Even today when I cross the Veru, I see the gentleman. When I was assistant professor in Third Surumula Medical College, where there was no urology unit, there was no instrument, there was no place of sitting for me. At that place, I found another gentleman, Professor Khadrul Islam, as professor and head of the Department of Surgery. He allowed me to do operation on his patient with using my instrument carrying from my home, sometimes by rickshaw, sometimes on foot. And this is my research shape, and this is my telescope, and this is my that is helix evacuator. And sometimes there was no monitor. So in this way, I did the job. And first time with the help of that gentleman, it was possible to present the 100 TRP within 6 months work in a place where there is no logistic supply. And it was in our second Urology Congress, International Congress. And for large prostate, to reduce time, cost and complications, I use extended cut technique. In this technique, the length of chips is 2 to 3 times more than conventional boot-shaped chips. And I compared this study, and with positive result, I presented this work in our one National Congress 2005. And the longest chip length was 6 centimeter in that study. And this work gave me extra energy to go with this journey. In 2008, I willingly left the government job and joined in a private hospital, my present place of work, which created some extra dimension and momentum in my work. This gentleman, Dr. Sheikh Mohiddin, under his leadership, there are 4 medical colleges in different parts of this country and 8 hospitals. And I have got the facilities to do this operation in all these hospitals. And especially I am grateful to Dr. Sheikh Mohiddin for arranging this free prostate camp every year. And I am enjoying this work especially, that is service for those persons, that are less privileged group of people, and this work I am enjoying for long 5 years. And this is our ending ceremony, all our post-TRP patients in our ending ceremony. And I am also enjoying in my present working place, that is Uro-Obstetrical Emergencies. That is one of the busiest hospitals in this capital city, Dhaka, where within 24 hours, average 40 cesarean sections operation done. And last 12 years, I am working in this hospital, and we have successfully managed 300 placenta per capita case in our hospital. And message for my young friends: do what you love, love what you do. It is not always possible to be best in all areas. Try to find out your key, unlock your potential, maximize it to do something good, better, best for your work, for the community, for your profession. That is my advice, my young friends. Now, I am thankful to my organization, BAUS, for inviting me, allowing me to present my work, and selecting me for this prestigious lecture. Thank you very much. Thank you for patient hearing.
Thanks, Professor Afiquor Rahman.